everyone, and this is going to be our last session, and before our closing remarks, and we are just embarking onto, and I'm hoping for an exciting panel discussion. So we have great experts from the other side of the world, Prof. Farrell, and I've got Dr. Mathew, and I've got our MP Jenny Kwan, and who I appreciate taking time to, with the busy schedule, to kind of join us today, and Sara Fudjack from UBC. So I'm going to do a quick round of introduction. So before we jump on to the panel discussion. So the panelists for about 45 minutes. And our hope was to kind of give a couple of minutes to kind of to give some opening statement for our panel members. And our title for the panel is what do we do next? You heard a lot about Let's Talk Overdose and all the crises, and we've been kind of hearing that all along this morning and this afternoon in BC time. And now it's looking at what are the next steps, and get some perspective from different panelists here. So that's our hope to kind of get around. And then we will also open the room for some questions, and I moderate the questions from the audience. And so we could see whether we could kind of share some insights or get some recommendation from the audience, or have some discussion about some of the crisis or crucial issues, what they're kind of bringing up. And then we would kind of end with having a short closing statement from all the panelists, and before we move on to the next step. So hello, everybody, again. And so it's Vijay Seethapathy, and I'm one of the psychiatrists, and I work as Chief Medical Officer at BC Mental Health and Substance Use Services. And this is at the Lower Mainland in Vancouver, BC. This is part of the Provincial Health Services Authority. So I work in complex mental health and substance use area. And as I mentioned, I've got 4 really exciting panelists here. And I'm just going to do a quick round of introduction. And I'm not going to go through all of their long, lengthy bios. I'm just going to keep it as brief as I can. And I've got Sara Fudjack. She's a registered clinical social worker with 15 years experience working alongside folks navigating addiction, mental illness, and recovery. She's the founder and program manager of Canada's first student recovery community, SRC, a campus-based peer support community established for and by students who experience addiction at the University of British Columbia. Drawing upon both the professional and living experience of addiction and recovery, Sara provides consultation services to post-secondary institution and affiliate organizations interested in cultivating inclusive campuses and communities for students and individuals who experience addiction. As a PhD candidate, her research investigates and addresses the impact elevated levels of stigma within post-secondary setting have on students navigating addiction and recovery. Welcome, Sara. So let me go to the next panel member, Jenny.
Can I just say really quick, my last name is Fudjack.
Sorry, Fudjack.
You got it.
Appreciate. Sorry about that.
Oh, no problem.
The next panelist is Jenny Kwan. Jenny was elected to Parliament to represent the diverse riding of Vancouver East since 2015. In Ottawa, she serves as the NDP's critic for immigration, refugees, citizenship, as well as the critic for housing and deputy critic for health. Starting her career in community legal advocate in Vancouver's downtown east side, Jenny became the city's youngest city councillor. She then served as MLA for Vancouver Mount Pleasant and was the first Chinese Canadian cabinet minister in BC. At all levels of government, Jenny has been tireless advocate for the people of Vancouver East and fighter for economic, social, and environmental justice. The pandemic has shined a spotlight on the growing inequalities, and Jenny stands with Jagmeet and the NDP to fight for just recovery to build a world where the necessities of life like housing, healthcare, food security, guaranteed basic income, and health and environment are basic human rights. Jenny stands resolute in the belief that united with one heart and one mind, we can build a Canada with a sustainable future, that respects Mother Earth, honors the rights of indigenous people, creates opportunities for all, and cherishes humanity. Welcome, Jenny. Thanks for joining us. And I've heard a lot of your talk, and very powerful in how you advocate for this complex population and the needs in the downtown east side and the Vancouver east side. Thank you. And I have here the next person, Prof. Michael Farrell. Professor Michael Farrell is the director for National Drug Addiction Research Center. This is in Sydney since 2011. Before, he was Professor of Addiction Psychiatry at Institute of Psychiatry at King's College London. His extensive research interests include treatment evaluation, national and international drug policy. He's the chair of International Consortium on Health Outcome Monitoring Substance Use Working Group and editor of Cochrane Drug and Alcohol Group. He has long-standing interest in drug dependence, comorbidity, and drugs in the wider criminal justice system. He has been a member of WHO Expert Committee on Drug and Alcohol Dependence since 1995. Welcome, Michael, and thanks to see you again. And I know you're coming from the other end of the world, other side of the world, and hopefully the time zone is okay right now.
Okay, thank you, Vijay.
I've got the last panelist here, Mathew. He's my colleague, and he's a psychiatrist. And Dr. Mathew is a medical director for complex mental health and substance use services with BC Mental Health and Substance Use Services. His portfolio includes the Burnaby Center, which is a center for complex mental health and substance use clients, the Hartwood Center for Women. Again, it is just primarily for women with the same population, and Ashnola Crossing, which was for the youth and young adults, and Coast Recovery and Rehabilitation Unit. A psychiatry fellow of the Royal College of Physicians and Surgeons of Canada, Dr. Mathew completed an addiction psychiatry fellowship at Yale University and a forensic psychiatry fellowship at University of British Columbia. He's board certified in addiction psychiatry, addiction medicine, and forensic psychiatry. He is also a clinical associate professor at the UBC and has won awards for teaching and research. Dr. Mathew endeavors to bring evidence-based, cutting-edge treatment to concurrent disorder population in BC. He's a strong advocate for healthcare improvements for this often marginalized population through his clinical and committee work. Thank you so much. Thanks for joining us. And as I mentioned, so the audience and all of us have heard a lot this morning from different perspectives on the serious overdose pandemic crisis. And we have put in a lot of efforts, particularly in BC, in kind of combating this crisis from the policymakers, from the ministry, from the frontline clinicians, from the health authority level. And we don't seem to have made a huge dent at it yet. So the numbers are still creeping up or looks alarming. And this current rate, we may end up looking closer to 2,000 people losing their lives at the end of the year. So I would really like to get some perspective from the panelists here to say, you know, what do we do next, and how do we kind of go forward? What may be the next step from the local perspective, the policymaker perspective, and also from the international perspective? So that's our focus of discussion today. So I'm going to turn to Sara to say, you know, what an opening statement from her, if you don't mind.
Sure, thank you so much. And it's just such an honor to be sharing this space with all of you esteemed panelists. So thanks so much for having me. I just first want to say, with respect and gratitude, I acknowledge that I am an uninvited settler on the stolen lands of the Squamish, Tsleil-Waututh, and Musqueam nations. And in the context of today's discourse, I'm reflecting on the fact that Indigenous and racialized people are disproportionately represented in toxic drug deaths, and on my own responsibility to address this by way of reform and reparation. So I know that my esteemed panelists will speak more on topics like safe supply housing and decriminalization. So for my portion, I think in my mind, there are sort of 5 to-dos for what we can do, which I'll just kind of focus on very briefly. So to me, the to-do number 1 is to really think about eliminating the silos that we have between harm reduction, treatment, and recovery. I think we know by now that no one group can do this work on our own. We've seen what happens when we operate in silos, and as Namaste Marzan says, this is heart-centered work. So we have to come together as a collaborative and collective system of care that empowers all pathways and spans all journeys. Perhaps we could think of this as a collaborative system of collective healing and connection that meets each person where they are and provides a menu of options so folks have dignity and autonomy to decide what on that menu works well for them. For me personally, having access to a menu of option at various points in my own substance use addiction and recovery journey, from safe supply to recovery as I personally define that, is what saved my life and why I'm here today to be able to talk with all of you. To do number 2 for me is to value experiential knowledge as much as academic and professional knowledge. I think the Vancouver model of decriminalization is a perfect example of where this went wrong. People with lived and living experience deserve so much more than tokenization and performative gestures. I met with a person with living experience last week who shared how they've been invited to sit at important tables to share their lived expertise time and time again for over 20 years. And yet they're still struggling to keep a roof over their head, food on the table, and just survive the day to day. So I think if you're a person in a position of power around policy, practice, education, research, or creating systemic change, to name a few, please hear this. At this point, it's about equity. People with experiential knowledge need to be placed in decision-making positions, and decision-making here is key, and also compensated for service, just like those who are compensated and respected for contributing academic and professional expertise. I can say personally, I was warned by several of my very well-meaning mentors and people that I love to not come forward in these spaces about my own lived experience and to just focus on my academic and professional knowledge. They told me it's dangerous. As a young person, it could impact my future because of the very real stigma that exists. And they're right, and I completely hear this. But at the end of the day, I do this, and I have been for a while now, because it's important to me to shine a light on this extremely troubling disparity and to ask those in positions of power to step up around this issue. To do number 3 would be a renewed focus on what it means to be an ally. Allyship is a verb, an action word. So I think we tend to think about stigma with a capital S associated with these topics. And I'm confident most of us don't ascribe to those. Yet it's the small stigmas, the unintended microaggressions, blind spots, and assumptions that, when left unexamined and underexplored, are also perpetuating harm. And look, I get it, we all have blind spots, I do too. It's just that we have to remember that to work in this field is to commit to lifelong learning, unlearning, and self-reflection, and going inward and starting to create the change happens inside. I can say that some of the most negative and hurtful reactions I've received personally when I talk about my own recovery journey, for example, has come from those who identify as my allies. And the judgment I experience around this is palpable. To do number 4 would be reform rooted in equity. We have a responsibility to disrupt patterns of oppression. We cannot just repeat the same exclusions and disparities. The disease lens has not done much to reduce stigma and has actually perpetuated it further. So systems need to be safe for people who are the most marginalized and oppressed to access. This means systems rooted in collaboration versus a top-down approach. It also means addressing root causes like colonization, racism, homophobia, and transphobia. And my final to-do would be to focus on youth. We know that the toxic drug supply is the leading cause of death for youth ages 19 to 39. And so to me, one clear place to start is taking a look at what's happening or not happening in schools. I think about post-secondary institutions that I'm a part of and that I consult with. And a lot of times what I hear is, oh, this isn't an issue that happens here. That's something that happens over there. That's absolutely false. And just finally, youth need to be involved in their own care as decision makers as well, so they have a voice in their own healing and are provided with a menu of options too. Thanks for listening.
Thank you so much, Sara. I think very, very beautifully said. And I think you hit on the nail on very, very important areas that we need to be working on. I think I can see here people are talking about how powerful it is to share those experiences here, and I really appreciate it. And I think you really given some food for thought in terms of how do we implement those things, from those ideas what we've given, and how do we kind of make it work on the floor, and how do we kind of eliminate silos? How do we create collaborative system of care? And how do we engage people with lived experience more meaningfully and more in a dignified and equitable fashion? And then lastly, you hit on the youth, and which is now becoming a problem just beyond adult. So we are talking about young persons dying of overdoses, and definitely we need to do some work on that too. No, thanks for sharing that. And I'm going to turn to Nick to give you perspective within the work you've done, and what do you see as the next steps here?
I think I can echo a lot of what Sara said, and I'll focus more on the field of medicine because that's more of what I know. And I mentioned some of this in the talk previously, but I'd like to repeat some of it here. So currently the way that we're looking at the overdose crisis is it's being conceptualized as an opioid deficiency. So when people have, say, iron deficiency anemia, if we get them enough iron, it will cure their anemia. In the same way, the current system that we have in British Columbia is that we're looking at opioid use disorder as an opioid deficiency, where if we can get people enough or varying kinds of opioids, this is what's going to save them. The BC Coroner had a report in 2017, and it showed 52% of the people who overdosed had a diagnosed or suspected mental illness. 58% of the people who were overdosed and died had a diagnosed or suspected chronic pain issue. So do some people use substances to party? Yes, but a lot of people are using substances to treat underlying issues. And we're not going to be able to stave off the overdose crisis without also being able to deal with the underlying causes of addiction, whether it's mental health, pain, or socioeconomic. The current way of doing things is leading to one of the highest per capita rates of overdose death in North America. What we need is integrated care in British Columbia. Now, I'm an addiction psychiatrist. I train mostly in the States. And in the US, addictions was not a recognized field of medicine until 2017. In 2017, it went under the American Board of Preventative Medicine. And like pain, it was recognized as a multidisciplinary subspecialty. So what that meant was that if you had a recognized field of medicine in the United States, whether it's family medicine, psychiatry, emerge, OBGYN, whatever it was, you could be certified in addiction medicine. In my fellowship, the guy who ran the methadone clinic was a hepatologist, and he combined methadone with people's hepatitis C and HIV treatments to amazing results. So most people who even are connected to a physician may only have one physician, whether it's their family physician or psychiatrist or whatever. So what medicine needs is everyone being eligible and part of addictions. So for a patient, no door should be the wrong door for receiving addiction care.
Yeah, you know what? Thanks, Nick, for sharing those insights. And I really, really like your emphasis on the integrated care and also the underlying causes for the addiction. I mean, not just the treatment from the biological perspective and psychosocial, housing, pain, mental health. I think that's been a resonating theme all along in the conference today. So, and also with evidence is what we've been hearing for quite some time. Now, thanks for sharing that. I'm going to turn to RMP, Jenny Kwan, if you don't mind, if you could share your thoughts on what do we need to do next and what do you think your priorities would be?
Well, thank you very much for inviting me to the panel and to engage in this very, very important issue. I'm zooming in from the unceded Coast Salish territories of the Musqueam, Squamish, and Tsleil-Waututh peoples. And I think that this particular topic as well really indicates the issues to which Canada's history and Canada's ongoing genocide against Indigenous peoples has inflicted, as I see it all the time in some of the constituents in my community, and particularly in the downtown east side. The truth of the matter is Canada is faced with 3 crises. We all know that. The COVID-19 pandemic, a national housing crisis, and the opioid crisis. These things go hand in hand, and we've seen how the government has managed the COVID-19 pandemic, right? With all of the resources that's been put into it, but yet with the opioid crisis and with even the housing crisis, we're not addressing the issues in the kind of urgency in which we need to. In my own riding of the downtown east side, while it is a strong and caring and resilient community, but we're faced with one of the most deadliest public health emergencies of our lifetime. And Sara spoke about stigma. The stigma against the people who live in the community is so strong, and especially for those who are drug users, those who are homeless, that are struggling with a variety of human rights, the lack of access to human rights like housing, and like violence that are committed against them, and even in their death, we have seen how that situation is normalized to the extent that people no longer seem to care. And recently, in my own community, a disturbing video emerged where women appear to be being sexually assaulted in broad daylight, and yet nobody did anything to help. A woman gave birth in a portable toilet and no one had noticed, and the baby did not survive. So similarly, apathy seems to exist for people who use drugs. Over 1,700 people have died in BC from overdose in 2020. This is an average of close to 5 deaths per day. And while the federal government says that addressing violence against women is a priority, that addressing homelessness and the opioid crisis are priorities, but their actions echo the apathy that has allowed these horrific deaths and acts of violence to perpetuate in our communities. 230,000 Canadians experience homelessness every year, and the National Housing Strategy only aims to build 150,000 units of affordable housing over 10 years, effectively saying that it is acceptable to leave close to 100,000 Canadians without homes. So with this attitude, is it a wonder that homelessness has become accepted and normalized? And likewise with the opioid crisis. The opioid crisis is killing more people in BC than the COVID-19 pandemic. But the government somehow does not see this as a national health emergency. Nick talked about every door should be open. The truth of the matter is so many doors are closed, and it all hinges on this. The hard truth is over 20,000 Canadians have died from an overdose since the government took office. And last year was the worst year yet on record. And the recent data quietly released show that in Alberta, Indigenous peoples are 7 times higher than non-Indigenous people to die of an overdose in the first 6 months of 2020. The closure of Lethbridge supervised consumption site led to nearly 100 deaths of Blood Tribe members in the months that follow. So overdose prevention workers and peers are now routinely issuing alerts about the severity of the toxic drugs that are circulating in the community. So what we need for elected officials and all levels of government to acknowledge is that people are dying, and they're dying in every community across our country, whether it's from the downtown east side to Port Alberni, to Edmonton, to Montreal, to Fredericton, to the Northwest Territories, to the Yellowknife, all across the country. It is happening in every corner of a community. And the sad reality is that the crisis of the overdose deaths is not new. People have been calling on the federal government for years now to declare the overdose crisis as a national health emergency and to treat substance misuse as a health matter. And that means we must stop criminalizing drug users. And I've raised this in Parliament over and over again, in letters, in debates, in the public eye. I've attended rallies. You have attended rallies, memorials, hosted town halls, met a long list of advocates, health experts, organizations who have all repeatedly said the same call. They are calling for the decriminalization of the possession of controlled substances for personal use. And that is the basis of the evidence of a health approach. In a press release, Dr. Bonnie Henry said, if, and I quote, if we are going to turn the corner on this complex crisis, we need to find ways to provide safer alternatives to the unregulated and highly toxic drug supply, and to end the stigma associated with criminalization of people who use drugs. She further said, we need options to provide people at risk of overdose with low barrier access to a regulated supply of opioids, and we need to connect people who use drugs with the supports they need rather than sending them to the criminal justice system. That is the essence of what we must do. This sentiment is echoed by so many now, including Dr. Perry Kendall of the BC Center on Substance Use, Dr. Shannon McDonald, the Acting Chief Medical Officer of the First Nations Health Authority, to the chorus of other experts, including even chiefs of police are saying that. Right? It was such a long battle prior to this that they would not take that approach, but even then they are changing their perspective. So what we need for the federal government to do, what the Prime Minister to do, is to acknowledge this and accept that science and stop judging people and take the politics out of it and to do what is right. And that is to decriminalize. I know that some will say decriminalization is not a silver bullet, but nobody ever said that it was a silver bullet. Nobody ever said decriminalization would end all of the issues. But what I've heard people say is that it will help stem the tide of overdose deaths. I've heard them say that decrim is an important step to ending the stigma against drug users, a stigma that allows for the deaths and the struggles of drug users to be normalized. The co-founder and director, Leslie, of Mums Stop the Harm, Leslie McBain, said, criminalization of people who use drugs tends to push them into the corners. It is incredibly stigmatizing. What is more stigmatizing than being arrested and thrown into the criminal justice system when in fact you have a substance use disorder and you need to have drugs you can only find on the streets in a dangerous and illicit way. Decriminalization is essential for people to actually come out of the closet, as it were, to seek services if they're available, and to start on a path of possible recovery. We find this as a very big step solving this tragic problem. That's what she had to say. So I do wonder, for the Prime Minister, does he think that it is acceptable to ask a diabetic to get their insulin from the streets? Or someone with a heart condition to get their meds from the illicit drug market? I think we don't need to ask that question. I think we all know in our hearts of hearts what the answer would be, and it is a resounding no. So how come substance use disorder is the only health issue in this country wherein people have to go to the street to get their medicine? Addiction is a medical condition and it must be treated as such. So I feel very strongly, along with my party, that immediate action needs to be taken. We need to decriminalize. We need to have medical provision of safe supply. We need comprehensive treatment of drug use and addiction as a health issue and not a criminal or moral issue. Too many lives have already been lost. And to put it bluntly, the waiting is killing people. So no more delays. Let's get on with it. And for those who want to say no to decriminalization, let me say this: dead people do not detox. And finally, for all of this to have an effect, I think Sara touched on it, and we need to also address the social determinants of health, whether it be about housing, access to housing, whether it be about food security, about all of the well-being that we ourselves want for ourselves. That should be available for people who are struggling with addiction as well. And that door is not open to them. And they're left on their own, struggling every day. And for me, their survival for one day is a miracle already, as it were. And mental health support that was talked about, all of it needs to come together to take that comprehensive approach without judgment. That's how we can solve it. So let's get on with it.
Wow, that's extremely powerful, Jenny. You know what, I think I've heard you talk before, and every time I speak, and I think it's quite moving. And you really hitting the nail on the coffin. Like, you know, it's really important points. And the indigenous focus is so crucial. And nevertheless, like it's coming back again, but I think it's really important. And you can see, like you mentioned, about 7 times the rate in Alberta, and in BC, we are not that far. We are close to 6 times the rate in 2020, and then which is double from 2019. So I think the indigenous focus, the social determinants, the homelessness, the decriminalization, I think those are fantastic and valid points. The audience are asking some questions, and I'm going to kind of keep it to the last 10 minutes about how do we actually make that happen, is the question about the decriminalization and what efforts we can put. And what about the public? I mean, what step they can take in terms of supporting the agenda about the next steps. So any kind of thoughts on that? But I'm just going to kind of park that ideas there, and I'm going to go to Prof. Farrell. Michael, if you're going to share some insights from your end and from the other side of the world, I mean, what do people do, and what are your thoughts, given your academic and clinical experience from Australia and also the rest of the world too?
Yeah, Vijay, thank you very much. And Sara and Jenny and Nick, thank you for your very moving presentations and calls. Just first of all, I'd like to pay my respect to the traditional owners of the land here in Australia, both past, present and future, and to recognize that I'm speaking from the Gadigal land of the Eora Nation. And the Indigenous issues here are very similar to the Indigenous issues in Canada, and the disparities in that remain a huge challenge. I'm speaking as an Irishman who has been over 40 years in this area of work, and I think the issue of stigmatization and marginalization has, for all of the time, been a huge and phenomenal challenge. When Jenny talked about the numbers, I'm thinking that the deaths this year in British Columbia are probably equivalent to the total deaths for the whole of Australia. So that is an absolutely astonishing disparity. And that actually, I think, makes me humble in relation to what we can do and what challenges we are facing. But there's no question about it that when we talk about resources deployed, if we, whatever terms we use, and I think we need to be careful about the terms, but 70% of the resources globally in most countries, particularly rich countries, go into supply reduction, and only about 30%, if less, go into demand reduction treatment. And for the last 20 years, we've been calling for that to be flipped, so that 70% of the resources would go into actually treatment and harm reduction. And I think the point Sara made of not drawing a division between treatment and harm reduction, seeing them as hand and glove together, is absolutely critical. And trying to have subdivisions within it is not the approach. We need a very heavy investment, and we need investment across all disciplines and all communities to support particularly people who use drugs and people who inject drugs to actually be a critical part of shaping our response. I think it's worthwhile noting that the actual community of professionals involved are often also professionally marginalized in both their resources and how they're actually responding to things. And sometimes we don't recognize that. I think the other thing is we need to play the long game on this. So the problem is we've got an acute problem, but we are actually looking at problems that take 20 years to be generated. the issue of social equity, housing, jobs, education, and particularly family and family disruption and support of families, I would say that we have very singularly failed in how to address family disruption and family support. And it's very critical to the future that we use our available resources. We have actually new and exciting resources to actually understand some of the developmental challenges, both for individuals and families and communities, and to look. And we have to be looking really root and branch at how to tackle some of these deficiencies. Now, we can't do, some of the work we do is really the ambulance at the bottom of the cliff, and that's not how to do things. We need to be up at the top, and we need a far broader, comprehensive approach. I have to say that whether we call it integrated treatment, but we actually need to be a bit careful about, as we roll out, invest and expand, we have to actually use our evidence building strategy. We have to be reasonably critical of what we're doing and to be clear when we haven't quite got it right, and to have the capacity to alter course. We actually clearly, if we look at the differences in jurisdictions around the world in terms of mortality and morbidity, there's clearly evidence that some people are doing some things better than others. And we need to be able to learn from each other. At the moment, one of the critical differences in Australia is we do not have a fentanyl crisis, but we could have a fentanyl crisis tomorrow. And I think at that stage, we would want to be learning from Canada. But I think I go back to the point of social equity, integrated care, and understanding the complexity of the problem. I came into this area with the advent of HIV and AIDS and injecting drug users. I think we were pretty, we made serious inroads to that. But at that point, there was no discussion about overdose mortality whatsoever. Now we've got, it flips around and it changes. But clearly, as Jenny says, you can't detox somebody who's dead. So keeping people alive is an absolutely critical part of this, and providing the resources to the system to keep people alive and to achieve better equity than we currently have. Thanks very much.
Thank you so much, Michael and Edward. I think you summed up pretty well, and you touched upon other panelists' important points too fairly well. And I think you really kind of make me start thinking about, okay, this is a huge task, but it's not like an undoable task. I think things have to be done not in a crisis response, but we need to look at medium, longer term approach. What do we need to take in kind of getting there? In terms of decriminalization, in terms of homelessness, in terms of addressing the stigma, while like advocating for that flip in the funding. And I was not aware of that 70-30. And I need to kind of start thinking about what happens in BC and what happens in Canada now. So I need to kind of go back and start digging down a little bit. That'll be very helpful for me to know. And that'll be very useful too. So I'm just going to kind of go into the audience. There are some questions coming up, and I just want to kind of put it out here to see who would like to take the tone. There's a question to Jenny. It says, thank you for talk about decriminalization, Jenny. How can we help you push this agenda?
Well, thank you for that question. I think, well, we have an election coming up, first off, I think. I could be wrong, but I think the government wants to go to an election and put it out there as a major issue. And to push these issues. I think fundamentally, Canadians actually on the whole are moving in that direction to say that we need to decriminalize, that they are more aware of the deaths that are taking place because it's happening in every community and people want something done. And so the government and parties who want to say that they will take action on the basis of evidence, right? And the evidence is clear about what needs to be done, and the experts are clear about what needs to be done. And so I would urge everyone to ask their member of parliament about what they're going to do about it, and to demand answers and a response, on this. And don't take no for an answer, because after all, what are we talking about? We're talking about people's lives. That's what we're talking about. And how Canada handles this issue on so many of the issues around inequalities, it is a display of our humanity or lack thereof. Remind them of that. We have a responsibility to act.
Yeah, any other panel members want to add anything on to that?
Sure, I would just add a quick addition to, yeah, I would just add a quick addition to what Jenny said. And again, that's just re-emphasizing the point that when we do, push these agendas, to government, that again, we make sure to be stressing the involvement of people with lived and living experience in decision-making roles. Because what we've seen with the Vancouver model of decriminalization is one example of many, is that, if we have policy going through that is not actually going to help those that are using drugs because, maybe they were brought in at the beginning, but then they weren't included in the decision-making portion of the conversation, then that is not going to make the differences that we're looking for. So again, just remembering that experiential knowledge is absolutely key as part of our evidence-based approach.
Yeah, no, thank you for that. And that's the kind of leads, Sara, I just want to kind of get your perspective on, there's a question around, what do you see the health professionals should do at their work to destigmatize person with use disorder within their practice? And what would your take on that would be?
Yeah, sure. I think sometimes when we think about how to address stigma, perhaps we think about it as just feeling so huge, or perhaps we think about it as something that doesn't pertain to us. And so I think, the first suggestion, myself included, is that I am constantly in this work reflecting on how I'm approaching this topic. What are my blind spots? Because like I said earlier, we all have those. And so it's kind of like the first step. We all can do it, because all it is about looking in the mirror. And there are several trainings out there. The student recovery community has one that we have been offering to nurses, counselors throughout our university, about how to be a more effective recovery ally, which is all about thinking about this stigma that we don't maybe realize that we're perpetuating as people in the field who care about making these changes. So to me, it would be about focusing there first and understanding what our blind spots are and doing the work to make some changes based on uncovering those blind spots.
Yeah, no, thank you. Thank you so much for that. That I'm just going to ask another question here. What I think, catching up from what Jenny was saying about the numbers is growing, and this is unprecedented in terms of the overdose, even beyond COVID. We're talking about 3-4 times, and the number even within a province we're talking about, and it doesn't appear to be slowing. And in terms of the national health emergency and the call for it, what the health kind of talk about clinician perspective on that? I mean, I'm talking about Nick or Michael. Do you want to comment on that?
Well, I'll talk. First of all, let me say, Jenny, could we have you in Australia? So we need politicians with your passion and commitment. It's extraordinary and so impressive, and particularly from the voice of Indigenous people. I'm really impressed. But I think one of the things I've spent many years at is looking at the links between the criminal justice system and the health system, and seeing that we get proper continuity of treatment through the system, and where that is absolutely critical to whatever social policy perspective you take on it. It's absolutely critical to tackling the overdose crisis. And some of the stuff available, even like some of the new depot buprenorphine stuff, it provides opportunities for linkages that we didn't have before. And I think, I really think that one of the serious bits we could do in a practical way, I think the social equity issues are going to take they're very much a long-term strategy, and some of the immediate stuff is available and can be done quickly.
Nick, what are your thoughts on that, Nick?
Sure. I think one thing would be to acknowledge the limitations that we have in medicine in terms of treating addiction. So the best treatment that we have for opioid use disorder is methadone. And even if you look at that, this is the best treatment we have. The retention rates are about 50% in 1 year. So if you start 100 people on methadone in 1 year, 50 of them will continue on the treatment. The other half won't continue on the treatment. So we have to look at the social determinants of health, like Sara and Jenny and Michael were speaking about. What Michael was saying earlier was that we have to look at places where things are working. And one of the places where things are working was Portugal. And in Portugal, they decriminalized drugs, but it wasn't just a simple decriminalization of drugs. They used some of the funding to fund treatment programs for people, but also they did things like they subsidized wages. So if people were diverted into the treatment programs in Portugal, people who employed folks would have their wages subsidized so that they'd be incentivized to provide jobs for people. We can't just have people be on a medication and then return to a tent with no purpose and nothing to do. We have to help provide these social determinants of health for folks.
Yeah, I know what, very well said, Nick. I really feel like there's a compelling need to get the recognition that this is just getting out of hand. And I think we are talking about it, but I'm kind of tending to agree with Jenny, like in terms of the call for the national health emergency, because the COVID, it generated a lot of traction, and the resources were kind of coming in. And this was at the federal level, not just at the provincial level. So I'm kind of tending to kind of go that route. But I think, like Jenny was saying, that the public should be working with the local elected members to kind of advocate for the need for this to be escalated higher up, and pitching this, and then so that like we can get the traction what is really required, and this is not slowing down. I fully agree. So I'm just going to just have a 30-second pitch in from each one of you, if you don't mind, as a closing statement. So before I kind of close the panel, I mean, there's a lot of discussion happening on the chat. It just kind of bursting with questions and comments. Thank you so much for an exciting panel. But let me just turn around and let me just go around this side at this time to go for Michael. Do you want to kind of start first, if you don't mind?
Well, I have to say I'm speechless with the challenge facing Canada and the United States, and I do think that you're right to say that it's a social, political, and moral crisis that needs to be fully confronted and needs political leadership as well as professional and community leadership to tackle.
Thank you. And I'm off to you, Sara.
I agree with everything Michael just said. That was a nice way to sum it up. And I just think we need to keep having these conversations, keep having these forums, and think about eliminating those silos so we can come together and do our best to make this change that we all so desperately need.
Thank you so much. And I see some comments coming up. The power of media and with the COVID and what's happening, and why can't we have ongoing traction for the overdose crisis? Just a quick comment there. And Nick, off to you for your final pitch.
I'd agree what Michael and Sara are saying. I'll reiterate my opening point. We need to have an integrative system where we're treating people as a whole person. So whether this is biologically, psychologically, socially, or spiritually.
Thank you. And Jenny, finally, if you could just give your closing pitch or some final statements, what do you think should be the next steps?
Well, in terms of next steps, I'm very conscious of the fact that politics is at play. There's no question. I just walked out of the Zoom meeting with the House of Commons, and today is the last day of Parliament, and we're widely expecting an election call in the coming weeks and months. And I think that as an interim measure, what the Liberal government can do is to implement a nationwide exemption under Section 56 of the CDSA to the prohibition on simple possession in Section 4. And this action could be undertaken within the existing legislative framework. So that is to say, you do not need legislative change, which will delay things forever and a day. So you don't need legislative change. And in tandem with this measure, I think it is absolutely essential that the government also provide ready access to pharmaceutical alternatives to the toxic drug supply across the country. And so acting immediately on these two measures is well within the government's power, and it will save lives. We know that it will save lives, and there is no moral reason or excuse to allow for the death toll to escalate for one day longer. If we did that, we could actually address this in a significant way. It's not the panacea. It will not solve all of our problems. It will definitely, though, make a dent on it. So I would say immediately, let's push the government to bring that exemption, that nationwide exemption. That would be a good start.
Oh, thank you, Jenny, and thank for all the panelists, guys. And I really appreciate your time and your passion and your insights into the next steps into this in tackling the overdose pandemic. And I've got those 5 large themes. I would say, like the eliminating silos, integrated care, social determinants of health, engaging equitably the people with lived experiences, and then we're really talking about the policymakers, speaking loud and clear about what the next steps are, and then taking this as even national health emergency as an to attract the traction. And then all of your point about the indigenous focus is really important. And then how do we kind of go forward and engage those community into this, and before we do the treatment or detox or harm reduction or the full-fledged planning to tackle the overdose. I think I'm sure there's a task ahead for us to do it, but I feel extremely hopeful, and I feel very inspired by all of you guys here. And thank you so much for the discussion. And have a good evening, or where you come from, good morning, the rest of the day. Take care. Just hang on, the audience, and you're going to have the closing remarks shortly. But thanks for the panelists.
Thank you.
Hi, hello, and welcome everyone to this last session. My name is Fiona Choi, and I am a research associate in the Department of Psychiatry, working at the University of British Columbia. And first, I would like to acknowledge that I live and work on the traditional, ancestral, and unceded territory of the Coast Salish peoples of the Squamish, Tsleil-Waututh, and Musqueam nations. And I was given the honor of hosting this final session as we wrap up the conference. We do have several awards to announce, and then we have a short video from members of our community, and then I'll just end us off with a few closing remarks. So first, let's move into our awards. We really wanted to recognize the efforts of so many individuals, and I know that the participants really spent a lot of time in bringing all this together. So it was very tough to vote for just one favorite. So we'll go right into it. The first award we had is for a Youth Ambassador Award. And this award actually goes to a group of youth. And we had launched a case competition that was calling for youth from both Canada and internationally. Everyone was invited to try to address the overdose crisis in one of their approaches. So they submitted a video, and then we had some finalists that were selected and then worked with members of our team. And today, I think they also presented again their final results. It was very difficult, I think, to choose, but we do have to. And so this youth ambassadors will be able to get involved in the projects that the ACD group are working on. They'll also be invited to participate in our next conference and also in the development of media for an e-health platform that we are creating in order to address the overdose crisis. And you can see all the competition entries on our YouTube channel as well, because I think that their efforts are wonderful. And even those who did not win this award, I think if they are interested, we would love to be in touch and work with them as well. So the award for Youth Ambassador goes to the team, there we go, the e-learning drug education program for youth. And the team members are Noor Ramadan, Maj Abo Shakra, and Jane Kim. So congratulations there, great job. And we look forward to working with you and having you take part in all our ongoing efforts. And then the next award is our Top Tweeter Award. So as we're aware of how effective social media efforts are, we wanted to recognize someone who really engaged through social media today and had a lot of positive interactions on Twitter, Instagram, and also on Huva, our event platform. And this top tweeter will receive a certificate, also will be featured on a post on our ACD social media accounts, and also will be invited to a future event in which they can live tweet the event. And because I guess our conference is not fully closed, I think this competition is still in the running. So the winner will be notified by email and that will be posted on our site. And the next, we also have Best e-Poster and Video Awards. And this was where our conference participants were able to vote for their favorite posters as well as their favorite video. And the winners will also receive a certificate. They will be featured on our social media channels, and also they'll have their e-poster or their video featured on our group website. So the best e-poster goes to the Tailgate Toolkit project, addressing overdose in the construction industry. And this was submitted by Emily Percival Patterson. So congratulations, Emily, great job. And then our winner for the best video goes to Take My Hand Chilliwack. That was the entrance, and that was submitted by Jody Higgs. And it was created by Pacific Community Resources Center and Doc Visual Media. So thank you for all your hard work and congratulations. And our last award, this is where we are calling it the Keynote of Tomorrow, because this is someone that also the conference participants were able to vote on. It was their favorite lightning talk. And so there were 2 blocks. And so one presenter from each block who received the most votes are receiving the Keynote of Tomorrow award. So there are 2 awards that we're giving. And that includes a certificate, also a featured post on our group's social media channels, and an invitation to present a workshop at one of our future conferences, which I promise will be shortly coming, I'm sure. So our winners for block 1 was the lightning talk titled Sparing No Pains, Soothing the Opioid Crisis During a Pandemic. And the presenters for that talk was Peter Johnson and John Christie Johnson. So thank you so much, congratulations. And in block 2, the crowd favorite was titled Collective Care, Traditional Wisdom in Modern Times. And the presenters are Len Pierre and Jordan White. So congratulations to all of you. Thank you very much for all the other presenters. I do think it was very competitive and it was very tough to vote for just one favorite. Okay, so after those awards, we have a very short video compilation we wanted to share with you. And these are messages from members of our community and just some of their thoughts and reflections. So I'll have Janet will play that.
Hi, my name is Jenny Kwan. I'm the Member of Parliament for Vancouver East, and I'm bringing these closing comments to you from the unceded Coast Salish territories of the Musqueam, Squamish, and Tsleil-Waututh peoples. What we need to do now is to declare a national health emergency. We need to take on the opioid crisis the same way we did with the pandemic. We need to follow the evidence and the medical advice from Dr. Bonnie Henry. We need to decriminalize for personal use. We need to provide safe supply. We need to provide supports for people who are faced with addiction. Our first priority has got to be saving lives. That's what we can do, and that's what we must do.
We must engage adolescents and young adults in the discussion. We must provide youth with appropriate programs that are tailored to their needs and preferences, connect them to services that are welcoming and cohesive, and equip them with first-line treatment options that are evidence-based and aligned with their goals. Youth must be given a seat at the table. For far too long, mental health and substance use disorders among youth have been brushed aside, and this has to change immediately.
We need to start thinking about how to better deliver patient-centered care and what that really means for the patients. People who use substances are incredibly vulnerable, and when they decide to seek treatment, oftentimes there's very little to no choice available to them, and wait times are so long that we are constantly losing patients in our healthcare systems. Having a choice of treatment and timely access to that treatment is critical for increasing retention and lowering overdose rates.
Tackling overdose and overdose crisis requires the partnership with the community of people who inject drugs. It requires a comprehensive treatment approach with saturation levels of opioid agonist treatment across the prisons and community system, and it requires clear strategies to tackle fentanyl adulteration and high-level provision of naloxone.
So what do I think is the next step in ending the overdose crisis? I think it's to legalize all drugs in Canada. Provide that path to create a regulated market, allow for quality control of these substances, ensure that these substances aren't being contaminated with other substances like fentanyl or carfentanil, and provide that knowledge to the person using the substance so that they can make an informed decision about their use and ensure that they're getting proper dosage.
My name is Michael Krause. I'm the UBC Providence Leadership Chair for Addiction Research. The current overdose crisis is the biggest public health threat for people using psychotropic substances and mentally ill, far worse than the suicide epidemic and other problems we see. In order to address it, we need to learn. We then need to learn from good examples in other countries. We need to reorganize our healthcare system and especially make our mental health and substance use services an integrated response to the current catastrophe. That is a priority, and we need to mobilize the best resources and the best assets in order to be able to stop that. It is stoppable, but it needs a significant increase in attention and resources. It's not going away. We will see a lot of victims. We need to stop that.
Okay, thank you. So just a few closing remarks then. As we close out the day, I think there really is a lot to reflect upon. And although our conference is nearing the end, I think we're all very well aware that the crisis is not close to any end unless we take the appropriate actions immediately. And as we've heard from many of our speakers today, in fact, all of them, there's really an urgent need for a system-wide change, and that has to happen in synchrony. So I personally don't think that we can wait for one area to resolve or improve before we turn our attention to the next fire, because the fires are happening everywhere. And I think that most of the world approached the COVID-19 pandemic with all hands on deck, as it really should be. But the overdose crisis also requires the same concerted effort from all systems. I think we need to improve crisis management and treatment support and retention for those with severe mental health and substance use disorder, just like how we mobilized our resources towards urgent care in hospitals and secured more ventilators and PPE in order to survive and save lives. But although that is urgent, it is not enough. For COVID-19, Providing medical care for those in critical condition happened at the same time that researchers worked on developing effective treatments, and all sectors worked to protect those who are most vulnerable. And there were also extensive measures taken to actually prevent the disease. Now, I know there are obvious differences between COVID, being an infectious disease, and overdose, and that preventing high-risk substance use and overdose is not as simple as hand washing and wearing masks, but the suffering and the loss is just as real. And I think public awareness and education still needs to happen. I think the stigma against those who use substances, and especially those who also suffer from mental illness and past trauma, hinders effective early intervention and treatment. And then I think as addiction becomes more severe, the harms and marginalization also increases. So we need to protect those who are most vulnerable, and this includes those who are marginalized and already at high risk of overdose, but it also includes those who are at earlier stages of substance use, including youth and young adults, providing them with appropriate support and with the skills to recognize risks and prevent harms. Now, just seeing the sheer number of people who are in attendance today from all different sectors and different parts of the world, I do believe we each have our own sphere of influence, and that together we can make some very important changes. So with that, I'd like to thank all of our sponsors and partners for the generous support, without whom we really wouldn't be able to provide this free event. So those are all our sponsors who are listed there. Thank you very much for your ongoing support. And if you do feel so inclined, there are ways for you to donate to cover some of the additional costs for today's conference and for future conferences on the overdose crisis. But please feel no obligation, but there is the information there on the screen if you so wish. And finally, I want to acknowledge the creativity and all the hard work of the conference committee and all those who have been working so hard behind the scenes just to make every single piece fit together so seamlessly. And it took a lot of coordination and in a relatively short time frame, I think. And a really special mention to Marisha, to Janet, and to Ava. I think you've all worked tirelessly to make this happen, and also the entire ACD research group. Thank you. And of course, I think we need to especially acknowledge Michael Krauss for his leadership and his vision, as well as his compassion for the vulnerable. And I'm sure he will continue to challenge us all into making some real innovative changes. So thank you again for joining us today. And I look forward to seeing you at the next event.